Hello viewers, today I am going to teach about the topic is distribution of drugs. Here the definition of distribution of drug is drug distribution is the process of delivering a drug from the bloodstream to the tissues of the body is called distribution of drugs. Here when the drug is administered through orally or parenterally or rectally or local administration, it get into the body through GIT or parenteral route or rectal form, and then absorption will takes place. After absorption, the drug is distributed through bloodstream to the tissues or organs of the body is called distribution of drugs. Here the deposition of drug into the organs or tissues via circulation depends upon the nature of drug. Here the drug depositions will takes place through nature of a drug. The drug is either lipophilic drug or hydrophilic drug. Its deposition of drug takes place into the organ or tissues through circulation of the blood. Here lipophilic drugs can have better distribution. It have lipid loving agent, so it easily cross blood brain barrier. Here for distribution of a drug, lipophilic drugs can easily absorption will takes place, and then it have better distribution because of lipid loving agents are present in the drug, so it is easily cross the blood brain barrier. Next, hydrophilic drugs are normally concentrated in the cells and they are referred as ion trapping. Here hydrophilic drugs are nothing but water soluble drugs. They are normally concentrated in the cells, so that's why only it is called as ion trapping. Here for example, I am giving lipophilic drug. Levodopa is converted to dopamine via the action of natural occurring enzyme called dopa decarboxylase, while we administer the drug in the form of levodopa. So after we administer the drug, disintegration dissolution will take place and distribution occurs, and it is converted the levodopa into the dopamine by the enzyme is dopa decarboxylase. So this occurs both in peripheral and central nervous system after levodopa has crossed the blood brain barrier. So it crossed the blood brain barrier. The levodopa is converted to the dopamine. So dopamine is converted. Then it occurs in the peripheral and central nervous system. Here central nervous system nothing but the attachment of brain and spinal cord. Next peripheral, rest of the brain and spinal cord, peripheral nervous system is present in our body. So here why we administer the levodopa? Because a person who suffers from the Parkinson's disease. Parkinson's disease is nothing but it is a disorder of nervous system, central nervous system, that affects the movement, cause tremor. Nothing but tremor means shaking of hands, like shivering of the body is called tremor to central nervous system. Next, here the distribution takes place through, if it is a tablet or capsules or pills taken through orally or inhalations. Inhalers are administered through orally, then it will enters into the GIT tract and then it will disintegration takes place and then dissolution will takes place. If the drug is in acid form, it will disintegrate in the stomach. If the drug is in basic form, it will disintegrates into the dissolution will takes place in small intestine, and then it will enters into the blood vessels, and then it enters to the upper area, upper part of the body, nothing but heart, liver, lungs and kidneys. Next, if the drug is parenteral route of administration, nothing but IV, intravenous, intramuscular and subcutaneous, it directly enters to the it directly enters to the blood circulations and enters to the upper part of the body, nothing but heart, liver, lungs. And if ocular drops, nothing but we administer drug through eyes, and it also directly enters to the systemic circulation. Or if we use the drug transdermal patch, it is also directly enters into the systemic circulation system. It bypasses the first part metabolism. So here, after the dissolution of a drug is enters into the blood vessels, the drug distributes to the higher part of the body, nothing but heart, lungs, and then liver. In liver it will be metabolized, takes place. In heart, the superior vena cava is a large vein that brings blood from the heart and arms to heart, and brings blood from head and arms to heart. Inferior vena cava is bring blood from abdomen and legs into the heart. So these type of circulations will takes place. After purification of the blood, it will metabolize takes place in liver. Hepatic metabolism, first part metabolism will takes place, and it will enters to the kidneys. Here kidneys, there is excretions will takes place. Excretion means the elimination of the waste materials or waste compounds through saliva or mammary glands or urine or fecal matter. It will excreted out. This is the distribution of the drug. And factors affecting distribution of drugs. Here, lipid solubility, molecular size, degree of ionization, cellular binding, duration of action, therapeutic effect and toxic effect. Here, lipid solubility. Drug molecules must penetrate the lipid bilayer of cellular membrane. So, the lipid solubility of a drug, it must be penetrate the lipids of bilayer, so it will easily cross the blood-brain barrier. Here levodopa is converted to the dopamine in blood-brain barrier. So molecular size is a factor affecting distribution of extremely larger molecules. So because this affects the molecular size, largest molecules will get effects. So we consider the smaller particles can easily soluble and distribution will takes place. Ionization, it depends upon ionization of a drug. Very unionized drug can go anywhere into the body. Here unionized drug means nothing but fat soluble drug. It is a non-ionized or unionized and fat soluble drug. It can go anywhere into the body. For example, bupivacaine, pyrimethamine are the more charged inside the cell than outside. So it is a local anesthesia. So it charged more in the cell than compared to the outside of the cell. Here non-ionized means unionized, it is a fat soluble drug, can easily cross blood-brain barrier, and ionized drug nothing but water loving drugs, water soluble, that does not cross the blood-brain barrier. Next, cellular binding. Here protein binding to proteins inevitable is nothing but sudden occurs in case of drugs, particularly lipoproteins, glycoproteins, beta globulins. These are the protein binding area. The extent of drug depends upon the affinity of the drug, means attraction of the drugs. It depends upon the natures of affinity of the drug. Next, duration of action. The duration of action of a drug depends upon how quickly the drug is eliminated from the body. After administration, distribution, next it shows its pharmacological action, metabolism. Then it will eliminated from the body. So how many hours is the drug is staying in our body? Either it is 2 hours, 3 hours, 4 hours or 10 hours. This is the duration of your action. Next, therapeutic effect. If the drug shows the efficacy rapidly, it have therapeutic effect. It shows the pharmacological actions rapidly, it have more therapeutic effects with less than of the side effects. Next, toxicity. If the drugs retains in body leads to the toxicity. If the drug is retains or stay in our body leads to the toxicity of the drug to the body. Drug addiction. For example, if we use the paracetamol daily consumes, it cause liver cirrhosis. Here toxicity. Food and drug interaction. If we use calcium, if we drink milk and also at a time we use antibodies like tetracycline, it gets to unable to absorb, then it form crystallization. Calcium oxalate will occurs and it is forms urine crystals forms. Next, vitamin K plus warfarin. If we choose vitamin K and plus warfarin at the time, it antagonizes the anticoagulants. So anticoagulants does not occurs. Drug interaction. Example, chlorine and plus propanol. These are the leads to hyper rebounds. So hypertension rebounds. Here again the hypertensions will occurs. Propanol is a hypertension, BP anti-hypertension, but with the clonidine it will again rebound the hypertension. Next, volume of distribution. The total volume of administered drug would have to provide same concentration in blood. If the amount is administered and also provide the same concentration in the blood plasma also, then only the volume of distributions will takes place. Here distribution of a drug will takes into one compartment method and two compartment. If the drug enters through GIT and directly its distribution, metabolism and then excretions will takes place. It is known as one compartment method. In two compartment method, if a drug is administered through GIT and then it will get absorption, distribution and metabolized. Through excretions, it redistributions will takes place in kidneys. So urine productions, it will redistributions will takes place in the kidneys and it is circulates to the body and the drug is retains to the body. So it is redistributions will takes place and after that it will eliminations will occurs. So this is the first compartment method and second compartment method in the body through distribution of a drug. This is the distribution of the drug. Thank you.